It's one of those conversations where everybody has been affected by cancer and many people affected by lung cancer. So today we thought we would put the spotlight on the disease and talk with a pulmonologist from the Pulmonary Medicine and Critical Care Medicine through Advent Health. Dr. Patel is with us now. Good morning. How are you today?
Good morning to you guys. Very well. Thank you.
So let's dive right in. Like most cancers, I'm assuming early detection is key. Let's talk a little bit about early detection of lung cancer. What are you working with? How is that even possible?
Right. So the cancer has been a disease which we have been fighting for a long time. Now, lung cancer is very unique in the sense that it is number one cause of cancer-related death in the US. Even in spite of new advances in medicine, we still struggle to take care of people with lung cancer. The reason behind that is that most of the patients get diagnosed late in the disease. And once they get diagnosed, it's difficult to treat them when they're late. So the key to treat lung cancer is early detection. There are lots of ways we can try to find out how to diagnose lung cancers, but the low dose CAT scan of the lungs, which is very unique in the sense that it doesn't have that much radiation, as well as it can effectively screen the people who are at risk of getting lung cancers early on. So most of the patients might have cancer even before they become symptomatic. So trying to catch those patients and treat them early is a key to diagnose and treat lung cancer.
So who are we talking about that should get this lung cancer screening per se, especially if maybe they don't have any symptoms? Is it family history, or what are you looking at?
So U.S. Preventive Service Task Force is an organization which recommends the screening method. So what we are targeting here is the patient who are at risk of lung cancer. And as you know, that number one risk factor for lung cancer still remains smoking. So basically, we are targeting a patient who has history of significant smoking. So when we say significant smoking, is that anybody who has a 20-pack year history of smoking. That includes if somebody has smoked 1 pack a day for 20 years versus 2 packs a day for 10 years, and anybody who is between age 50 and 80. So those are the people who we think that we can identify them having lung cancers early on so they can be treated. So the people who are at risk should be screened.
So Dr. Patel, if you do start to develop some symptoms, what do those symptoms look like? When do you know it's time to talk to your doctor about this?
Right. So as I said, that lung cancer is unique in the sense that most of the patients do not have symptoms when they have cancer. And by the time they have cancer, it's too late. So it's very important that we should not be sitting on the symptoms. So any patients who have chronic, let's say patient might have bronchitis after bronchitis and keeps on going to doctor, they should be make sure that they talk about all those things. Second thing is that coughing up blood. So we're not talking about vomiting blood, but coughing up blood, hoarseness of voice, worsening shortness of breath, weight loss. So those are the common symptoms patients usually will have with lung cancer.
Well, in closing here today, I want to get your thoughts. What can we do? I know so much of cancer is still, question marks and studies that are out there, but what can we do for our lungs to keep them healthy and strong?
So, these questions we get asked a lot. And since with COVID, it's very important that we take care of the lung. And as you can understand that lungs are the organs which continuously gets exposed to environment. So any kind of things which we inhale might have consequences to the lungs, right? So any smoking, we're not talking about active smoking, anybody who's smoking next to you. There's no safe way of smoking. So people think that, hey, listen, I'm going to do alternate ways of smoking. That any smoking is detrimental to lung. Other things are environmental things. So let's say if we breathe pollutant air, that has consequences to the lung. With the COVID, we have learned that all these viruses, which can be very challenging to treat lots of times. So prevention is the key. Washing your hands, make sure if water is not available, sanitizing your hands, stay away from people who are sick. If you're sick, please don't go back to the work. don't get exposed other people to the sickness. Simple things like getting a flu vaccine, getting if it's appropriate, getting a pneumonia vaccinations. Those are the important things that we should be doing.
Well, Dr. Patel, thank you so much. I'm so glad we were able to talk about the importance of getting that lung screening done. And as always, you can get more information from yourcareexperts.com.
Thank you very much.